Welcome to the Mental Health Minute podcast. My name is Kris Salyards, and I'm the Executive Director for the Bridge Youth and Family Services. We provide mental health and family stabilization services to youth and families in our community. Through our podcast, we will talk to partners and experts, learn from Bridge staff, and talk with individuals who've received support through our services and who've become stronger as a result. Normalizing the conversation around mental health creates healthier individuals, families, and communities. Looking forward to sharing with you. Welcome back to another episode of the Mental Health Minute. I'm your host, Kris Salyards, Executive Director of the Bridge Youth and Family Services. Today, I am happy to be joined by Chelsea Laliberte Barnes, who is founder of Live for Lali. So Chelsea, why don't you introduce yourself?
Okay, I will try. I'm first of all, I'm a mom. I'm a social worker by trade. I'm an activist who deeply, deeply cares about people and communities and just a family person. But I think I don't know. I'm not really that. I think a lot of people who find out what I do or who I am think I'm way cooler than I actually am. I'm a nerd. I just watch movies and read books all day and go work out and then come home and then work in between that. So
yeah, well, I think we met each other way back in the day when we were both in executive director boot camp at Axelson Center. And I was so taken by you at that time because you were just building Live for Lali, or you were maybe in your early years of Live for Lali.
What year was that?
It had to have been 2015 or 16.
So we were 6 or 7 years into what we were building.
Into what you were building. And your story was so heartwarming and challenging. And so I just wanted to, as we queue up International Substance Use Awareness, I thought it would be great to have you on and talk about why this hits home for you and how you have your roots.
Okay, two-part question.
That's how I am. I'll try and be more succinct.
I think also just to say, I think I talked to you and one other person that I met during that, and that's fine. If you can go out of those things with just one or two people that you've stayed connected with, I think that's kind of a miracle. But okay, so if the shirt isn't giving it away, I have a deep, deep empathy and compassion for anybody who considers themselves an underdog, first of all, and especially people who are mistreated in our society. Whenever since I was a little girl, whenever I see anybody, and maybe that'll give you a clue into what maybe some of my childhood was like, but feeling less than, I do not deal well with that. I immediately, since I was young, have always been really affected by watching bullies and watching other people be mistreated. And I didn't actually know, nobody ever does before the story of why Live for Lali exists is my little brother Alex died from an overdose in our home in 2008. And it came out of nowhere. It's not like, I think a lot of people have a very almost like Hollywood-like idea of like what happens to families sometimes, where there's days and years of addiction, or, you're in and out of treatment for so many years. And yes, that is a very real story for many people. But my brother and I were just kids who liked to party, and Alex's escalated in a different way than mine did. My connection to drugs and alcohol was not great, but Alex's was certainly more prevalent. And I think we missed a lot of things that we just didn't know to look for. And so Alex was really young. He was 20. He had like the world ahead of him. He was one of these kids that you wanted to just he was so smart, like a little too smart, a little too manipulative, a little too charming. So adorable. You would love him in his quiet presence. Like we were very different from each other. And he was just a good, kind-hearted person, like shirt off your back kind of guy. So, the day he died was the day we found out he was using heroin. Like we didn't know that he was specifically using what he was using until that day when the police told us that that's what they felt that it was. And then the toxicology report ended up confirming that. And so that was the cornerstone moment of my life. I've never looked back. I mean, I thought my life was going to be one way, and then Alex died, and that was it. Like, you don't know who you are going to become when certain things happen to you in your life. You just can never see it. Everything stopped. There was I don't even remember sometimes who I was. It's kind of like when you have kids. If you don't have kids, you don't know what the statement, like, I didn't know who I was before I had kids. Like, that's how I felt about losing Alex. Like, you lose a part of you. It's like half of you gone. And I miss him. Yeah. I miss him a lot. We're coming up on 17 years. Yeah. Is that, I can't do math. I'm not a good math person. Is that how long? Yeah. It's been a long time, but it feels like it happened yesterday some days.
I'm sure.
Yeah, so we miss him, and the mission is still very much boiling in my belly.
Yeah.
It's just taken on a different life force over the years. So Live for Lali is essentially, I figured that would be one of your questions, is an organization that provides support for people who identify as wherever they are in their journey with substance use, whether they're personally using drugs, used drugs, what do they identify with as being in recovery, whether they don't. We don't discriminate based on somebody's relationship to a substance or their loved ones. We are just here to support them and love on them. And we do that through peer support. We do that through harm reduction services, which I know we're going to talk a lot about. We do it through education, public education and awareness, and policy and advocacy.
Yeah.
And that didn't start that way. It ended up that way.
Okay.
And thank God it did, because I think things would be looking a little bit different.
Yeah.
If not for that model.
So what lessons do you think you've learned as you've worked with more and more people who are on very different journeys in their substance use recovery? What are do you have common themes? Do you have things you look for? I mean,
I think trauma. Like, I think you can't, and especially at becoming a therapist over the years, becoming a social worker, becoming a therapist, you never have a different person walk into your office with the same story, but there's pain. And I think that pain is really a big part of the conversation that we like to push away because we can't see it. We can't identify it. We don't understand it. We know what pain is. Life is full of pain. But to fathom what leads somebody to behave in a way that they would be, as some people think, intentionally harming themselves, I think is kind of like a misjudged statement. But I think that's how we think about it in our world, even though we all have things that we do that might not be so great for us. Mm-hmm. So I think the commonality is lodged in a lot of deep-seated feelings of negativity, self-negativity experiences. I mean, I think it really is an all-encompassing sort of situation. Mm-hmm. And no one's substance use looks the same. Everybody likes different things. Everybody tries different things. Everybody have different personalities, We can't just talk about people who use drugs in a vacuum as one thing. Like, I think we often think, like, I hear people say all the time, when people are struggling with addiction, I'm like, well, not everybody who uses drugs has an addiction. I know plenty of people, and when I say this, people are kind of like surprised, that use illicit drugs or alcohol in ways that are probably problematic once in a while. Mm-hmm. And so I think that would probably be the most common thing, is that there isn't, what is common? I don't know. We're all humans. We're all different and dynamic, and we have to meet people where they're at. I know everybody's saying that now. Well, if we're really going to, then we really must.
Right.
And that means really taking everybody as individual people.
Yeah. Well, and now that you're doing, providing counseling and therapy, how do you see substance use? And you say a lot of trauma, right? A lot of people's substance use can be rooted in trauma.
Right.
But how to begin, right? I mean, where to start in terms of using that harm reduction model, which is really scary for a lot of people, especially when, we work with a lot of kids, and kids don't see this. They're not there yet. They're like, this makes me feel good. I feel numb. I have access to this. I might not have access to the right medications, the right services, because, that requires a gatekeeper. That requires someone to help them get access to services, right? But they know the weed man.
Right.
So where to start? That's a big loaded sort of like,
well, you certainly don't start with, tell me what happened to you, we don't start with that. We start with hi. Like, you just start with a smile on your face and a hello. Like, when we go out and do outreach in the community, it's with no intentions. Like, the intention is just to be and see people. And I think we do that in a number of different ways. Some people who, I think it has to start with, I think, a recognition that at Live for Lali, and I think they wouldn't mind if I said this, we don't believe that the ultimate goal is just to be abstinent. That's not why we do what we do. We do what we do to meet people, see people, make them feel seen and heard and like valued, and keeping people alive. At the very core of what we're doing is about keeping people alive. And then on like I think a much more ingrained like visionary scale, just like encouraging the community and the public at large to view people as human beings. And I think that's been where the rub has been and the challenge has been from day one. But it's the challenge that I wanted to take on of how do we reduce stigma enough to be able to like get somebody to walk out of their house and be like, I'm going to go to the Live for Lali truck, or I'm going to call or DM or whatever, however they want to get a hold of us. Or even just to think for 1 second, is what I'm doing in my life working for me? Mm-hmm. Is there something that I want to change? Is there something that I need? Even if for that day it's just the idea and the thought about it. Mm-hmm. I mean, that comes from helping to send a message that you're important and valued. And I think we try to admit that in every way we can. Yeah. By just being with people. Mm-hmm. And I think a lot of our field is mostly about a lot where we've gone wrong. And I'm not saying this treatment is wrong. I'm a treatment provider, is expecting that treatment is the first step. That's not the first step. If you can get to treatment, gosh, what is the statistic? Like 10% of people who have a substance use disorder. And I think we can even probably extend that out to a lot of mental health challenges, but especially with substance use disorders, actually get treatment. Mm-hmm. Like, that's wild. Mm-hmm. In this culture where we're now telling everybody to get treatment. Right. But still, only 10% of people actually get it.
Well, and why do you think that is?
Oh my God, this is going to take so long to explain. I think so much of it is rooted in just like the formation of our society and the systems and how, the systems. So one part of it is systems design. I don't think that our society probably felt that they were going to need to create an entire mental health system that is embedded with healthcare in the way that physical healthcare is today. So where did that come from? Stigma. I mean, it's all related to stigma, I think. And that comes with, okay, what is this type of society that we want to craft? And I don't think our leaders want to be engaging in a way that's in any way endorsing misbehavior. I'm just going to say that in quotes. And so you create the systems that you want to design. And so a lot of the times people are like, the systems are broken. No. They were designed exactly to oppress and exactly to leave people out. Mm-hmm. And so I think a big part of it, that mental health being a cottage industry that was built outside of the general healthcare system is a big part of it, that we have to now justify. Why do we need to bring mental health care into the fore? Why should it be outside of the social services system? And then how do you grow it? So, I mean, Live for Lali became a way to serve a chunk of people who weren't able to access that system. And we wanted to be the gap fillers. In the data has guided us on that path the whole time. Mm-hmm. So, I think we have a lot of work to do, but I think a lot of this is so ingrained in us, and we'd have to really lift up, like we'd have to get to the roots to see it. And I think I really want to encourage people to learn how that all happened.
Yeah. So can you convey a story just to help people who maybe don't understand this? Like, do you have a story that you could share?
What is this?
Understand this part of mental health.
Oh,
understand
sure.
this part of substance use, right? Because just like everything, people have a preconceived notion. You said it yourself, and
You're right.
now we're hearing, I'm gonna set my question aside for a second. Now we're hearing more about people having Narcan available, and do you have it in your car, and do you carry it with you, and do you know where you can get it? And I'm thinking, okay, but have we been trained in how to use this, and how do we know? So there's this general, I'll call myself ignorant because that's not my universe. I don't provide substance use services. But yet it's so adjacent and probably interconnected to what I do. Mm-hmm. So now all of a sudden I feel lost.
Yeah.
Right? So
I love your humility about that too, by the way, because I think what we've done is like made every single social service provider feel like they have to know everything about everything. And that's not true. I think what I'm hearing you say is that the Bridge, for example, has become experts in what you do, and you rely on your partnerships to provide information and care that you just don't specialize in, and you know what your bailiwick is. I think that's really important. So I just want to give you credit to being able to say that, because we don't live in a society where we don't like to not know things. Or we do. That's a whole other conversation.
Well, true.
But to answer your question, I think so I don't think that you have to know, again, everything about everything. I think you just have to, at the very least, know who can provide that service if they need it, and be able to have the basic knowledge and the basic information about all of these things, I think, as social service providers, to know, okay, I know that we don't do that thing, but here's who I know that does. Mm-hmm. And so I think a very simple way, for most mental health organizations to think about this is you have an AED provider, you have somebody who has set up the safety systems at your organization. Well, this is a part of that safety system. If you have a building where you're engaging with people, any person who could walk into that building who is struggling with a mental health issue may be at a higher likelihood of using substances right now. And if they are, the substances that they might be getting on the street are so potent and contaminated that at any point you, and this is just facts, you're more likely to encounter somebody on the street who is overdosed than is having a heart attack. Mm-hmm. You're more likely to see and witness an overdose than a car crash. That's bananas. So I think it's basic stuff. You don't have to be an expert in this, but you at least have to be, I think, aware of what do I need to know that I don't know, and how can our partners in the community come in and provide a service that, whether it's training your staff, whether it's, getting you guys Narcan, because the state pays for it. Thank God we have these, state-funded systems right now in Illinois. It's not a cost to you. It's not a cost to your, but how would you know that if you didn't know, the basics?
Right.
So I don't know. I don't know if that exactly answered your question, but I think that you can kind of apply that to a family, right? If you see your loved one who's struggling with depression, that's related to your feelings and emotions and thoughts, right? Mm-hmm. It's related to your experiences in the world or how you feel about yourself. A lot of people self-medicate who have depression through substance use. A lot of people self-medicate, this was my thing as a person with anxiety, through substance use. Alcohol was such a great reliever for me of that.
For sure.
So it's not that far off because the window is this big, right? I just want to feel better. Mm-hmm. I don't want to be in pain. I just got to get up off the couch and do something today.
Yeah.
That kind of stuff.
So we work with a lot of kids, and we have a lot of reported, marijuana use among our kids. Sure. And, I guess one of the things that I'm wondering is there some education that we should be providing them? Obviously we're providing them education. This is not good. We need to find other alternatives for you to feel better. Maybe we can talk to mom and dad about getting you an appointment somewhere. But I think, at least for teenagers, I think they learn so much on TikTok.
Yeah.
And they have TikTok therapists telling them what to do, and they have TikTok kids on TikTok telling them what to do. And
everybody's a coach now.
Everybody's a coach. Everybody's a coach. Yeah. And so, I guess the question is from an organizational standpoint, you have a nonprofit and you work in a nonprofit. Maybe.
Well, Wolfpack is not, but we are infused with nonprofit experience. Yeah,
sure.
correct.
So from an organizational standpoint, which gets to some of the microsystems, right? Not really into the root, but some of the microsystems. Where do we start?
Oh gosh, I know, right? Okay, well, if we really want to get to the root of your question, I think it's like, okay, and I complain about this about police all the time. I think it has to happen in the academy. I mean, we all have our different experiences with mental health and substance use, and then we end up going into this field, right? And so we're carrying with us our story. We're carrying with us what we've seen, what we know, how we feel about people in our lives who have probably disappointed us, right, most of the time. And then you go and you become a helping professional, and you're going to get a lot of training, right? And I think a lot of the time substance use is like a tract. It's like you have to be kind of interested in wanting to learn about it. Mm-hmm. So it's not necessarily ingrained in every counseling program, in every psychology program, in every, in our schools. And so I think it can't fall, though, on us. We can't be the only entities that are providing this information. But I think there are, like we were just talking about with Narcan, like basic things that you can and probably should know if you're engaging with people and you're seeing a trend as people who are running organizations or people who are developing programs or operating programs. What is the thing that the people you are trying to serve are showing you or telling you or asking for? And if there's a trend there and you're saying there's a trend with young people in cannabis, yes, there is. Mm-hmm. What are the basic things that we need to know to be able to be advocates for those young people? Not to tell them how to live their life, but to be able to give the parents and the child like basic information and to be able to get to the point where you can develop a plan of, okay, well, how do we handle this from here? And every family is different, and that's what makes it so hard. Mm-hmm. Every family is different. And so I think it's a real challenge. And I think, sadly, there's just not enough information right now about what we know generally. Sure, we know things. We know enough about like using drugs before your brain is developed, right? We know a lot about what's in how powerful and potent cannabis is that you could get from a dispensary and how much of a crapshoot it is to get cannabis on the street. We know it's changed over the years. We know how prevalent it is for the brain and the rewiring of the dopamine system. We know those basic things. And if you know those basic things, for you to then say, how do you feel about the cannabis that you're using? How do you feel about your cannabis use to a young person? Might be like a wild kind of like, whoa, like no one's ever asked me this before. I think it comes down to like, you don't have to know everything. You just have to care and you just have to be curious. Mm-hmm. And again, know who the resources are in the community. I don't know. What do you think? Because if you're seeing this, what are you learning?
Oh, my brain is spinning. But I know. Going back to what you said a minute ago, I think we do take, what are psychotropic medications. We get a whole course in that. Yeah. So we maybe should be learning about the self-meds, and especially in the trends, and that's impossible. Drugs change so rapidly and they get infused with things and, there's just so much information that, to your point, we're humans, we cannot possibly grab all that information, synthesize it, and figure out what to do with it. It's just not possible. Right. But, when we think about from the human condition and the human level, and we see people labeling others, and we see people dismissing the issue. There's as a human services professional, it feels like you carry this big onus. I need to educate you. I need to help you. I need to monitor you. I need to protect you. I need to inform people. I need to give you resources. I need to know what's out there, and sometimes it just feels so overwhelming. And so it maybe is just going back to the human condition and trying to heal the why, which some people just will not be ready for.
Right, which is exactly why I think harm reduction is so important, because it actually is integrated and littered into every single type of challenge that one person can have. There is a way to reduce harm with every single thing that we do, because there's no such thing as a perfect existence and making perfect choices. And because we've pretended like there is, or believe me, I'm all for I'm all for like trying to achieve big dreams in a society, but we're like, for example, we're never going to have a drug-free society.
No.
Sorry. Spoiler alert. It's never existed. It's never going to. And we have plenty of history to tell us about that. And so I think you're right, though. I think human services professionals, we're so trained in the systems that we don't sometimes know how to get out of it once we're in it. And I think that is a testament to how much we care and how much we do and how much we put on our backs and why we need to be paid more and why we need to be valued by the systems that we serve, by businesses, by industry, by our government. It's so funny. We're like doing this podcast show in this beautiful, huge mall like business plaza, right? And it's beautiful in here. How many people work here who must be struggling with some sort of mental health issue, and how is that contributing to the productivity and the outputs and the outcomes that those shareholders, those businesses want? Like, we don't even think about like what happens when we don't care for people in this world. So who's going to take that on? We are, and there are not enough of us, and we can't operate at this level anymore. So I know that's a whole other podcast episode, but it's true.
It is. Yeah.
Gosh, I could ask you a million questions about what you're facing as a nonprofit CEO who's just like in this and sees it from so many levels. But so at the very basis, harm reduction is a way where we can at least try and prevent really, really bad things from happening. And the way that we look at it in the drug use world is preventing the spread of diseases, preventing, it's things that you don't even think about, like abscesses, preventing blood illnesses, preventing hospital stays. That all has a cost to the taxpayer. That's much larger than what a syringe costs. Syringes cost 50 cents. Okay. Or preventing overdoses. Every overdose costs like $40,000. So if you don't even care about this issue, if you're like a person who's listening to this, you're like, this doesn't have anything to do with my life. I don't know why I care. Well, it's going to cost you in our taxes. It costs us in so many other ways. Communities suffer when individuals suffer. So yeah, I think at the bare minimum, we can do harm reduction for domestic violence. We can do it for non-suicidal self-injury. We do it every day when we get in a car. We do it every day when we're going to the beach. We do it when maybe we're taking a GLP-1, right? Like everyone's taking GLP-1s now, me included. But like, you're losing muscle mass. Okay, well, I'm going to go to the gym and try to strength train. That's harm reduction.
Right.
But a lot of people don't think about it that way because we're not trained to think about public health as the strategy.
Right.
So there you go. Training and education. We really missed it.
And yeah, education for sure. And I keep going back to how this all intersects and how it's so prevalent or should be prevalent in our dialogue right now. The shifts from health insurance, and I think about it, even in my own personal orb, if I have somebody who has been looking for employment and can't find employment and hasn't been able to find employment and now loses their insurance, has high anxiety, debilitating anxiety, which means they can't go to work even if they figured it out. What do you think people are going to do? So it's the perpetuation of systems we blame for all of our problems and then continue to make decisions that exacerbate those issues and those problems.
Absolutely.
And so,
are you referring to cutting Medicaid? Because that is really keeping me up at night.
Well, It should be.
Yeah, it should be keeping all of us up at night. Absolutely.
And the homelessness.
Oh,
and I mean,
absolutely.
It is.
So let's just, you know what? Let's just cut it all. It's bound to get better if we just cut it all.
Or it's just blight. We'll look up here.
Yeah.
And
because maybe this will like really motivate someone to get off their ass.
Yeah.
Sorry. I mean, there's nothing like poverty to just motivate you to go out in the world. My God, what Kool-Aid are people drinking? I'm so sorry if this is offensive to somebody listening right now, but wake up.
Yeah.
Please wake up. It is happening all around us.
It is.
And that's about as political as I'm going to get right now.
Yeah, for sure. And it's, we should just leave it right there.
Oh, God, please don't.
But let's go back to the softer side of things, because you have lived experience, you have professional experience, you have a ton of education. So I'm a parent, and I discover that my kid, this isn't my story, I'm just
this
role
is
playing.
great. This is great. Keep
So
going.
I discover that my kid is using substances, and I screw myself right into the ceiling, and march my kid into therapy. And I'm like, you gotta fix. And so parent is feeling all the things.
Yeah.
Fear and blame and guilt and shame. And I mean, just name it,
Mm-hmm.
And the kid is like, I feel pretty good, right? I feel pretty good about, I'm not proud of it.
Yeah.
But it makes me feel good.
Yeah.
So let's talk to the mom.
Yeah.
What do we say to her?
Gosh, first you got to wrap your love around that mom. I don't mean literally hug her, because she might not want that, but empathy. I think saying like, oh, my gosh, and as a mother, we're both mothers, saying like literally just saying like, wow, that is like one of your worst nightmares as a parent. Like, what did I do? Mm-hmm. And like just being able to process that yourself. But I think, of course, because we're mothers and we're women, we go into action really fast. And sometimes when we go into action, we go into an old place, or like a place that we were trained in.
Yeah.
Right? Like, you can't do this. And it's like, wait. Yeah, right. Like, you don't want them to do it. Let's acknowledge the truth. You don't want them to do it. Nobody wants their kids to be using drugs or even experimenting with drugs. Even if you've said or had a conversation with your spouse or your partner or whatever, if our kids use drugs, we're going to really love on them, and like, experimentation is okay. I just want them. And then you don't do that, right? Because this is like your worst nightmare as a parent. So I think it's just first saying to the mom out there who might be listening and thinking like, is this just supposed to be okay, Chelsea? No, you do not have to be okay with this. Your feelings, whatever those are very, very valid. Please know that. And second, I think people are inclined to want to, we're going back to fixing the problem. But I think if we actually take a step back and we think about where we were as kids, I go back to, nobody ever asked me when I started smoking weed at 12 what I wanted or why I was doing it.
Yeah.
You know why I started smoking weed? Because I had a really big crush on the guy who offered me weed. There was no other reason. Peer pressure. Didn't even think about how it might feel. Everything I was taught by my parents in a religious community, like, didn't matter. I wanted the guy, right? We go back to our foundations of just being seen and wanting to belong. And sometimes all values systems out the window, right? So I think it means that as parents, we kind of have to just take a step back. If you don't know what to do, if you don't know how to respond, ask for support, ask for help, ask for guidance. I think that's why, you have some people who specialize in substance use like me who are out there. And I think first we have to listen. We have to make sure our kids are safe, right? So it's your parent, you're the parent, it's your house, it's your rules. It really is. If your expectations, if you've never had a conversation with your child about what your expectations are around drugs, now might be the time. If you have, and they've violated that, then we can work from there, right? But what we don't want to have happen is we don't want the reaction, the response to be a reaction where you end up pushing your child away. You want them to see you. You want them to feel seen, and you want them to feel heard. but you also want to set a tone of, this is not okay with me. If it's not okay with you, you know? And then I say it that way because culturally we have a lot of different situations that are going on. I mean, family to family, you're going to have a different decision-making process around that. And there's no perfect way. The only thing I will say is, if we want to prevent our kids from developing addiction, we have to prevent them from creating an addiction. So how do we do that? We have to start with, what is this? You know, what's going on? You know, tell me about this. Like, you know, where did this come from? And I'm just curious. Curiosity. It's hard to be curious without sounding judgmental. Like, let's be honest. But you're the mom. You're the parent. And so we have to set the tone. And that's really hard to do. So I think all of this to say is, I don't have the perfect answer because every scenario is different. All I can tell you is, who is your support system? What are your resources that are out there? In our community, we have some really amazing resources for young people and families, like, for example, Omni Youth Services, Kenneth Young Center. We have amazing community behavioral healthcare centers that people don't even know what that is, which is another podcast, right? But we have agencies in this community, smack dab in this community, that are specialists in this. We have therapists that specialize in dealing with adolescents who are engaging in risky behaviors, and that has to include substance use. We have resources in this community. Use them.
Great.
What do you think? I don't know. I want to hear what you have to say now.
Because I love that. I mean, you know, you say a lot of things.
I know. I was like, how do I answer
I
this?
think you say a lot of things that like have me thinking, and it's really hard to unravel the parenting style that you were given.
It really is.
I mean, and let's be honest, there's a whole group of us who feel like we were feral until, and we weren't. We just had, we were the last generation before seatbelts, and we were the last generation before all the big rules came out. So we were right.
Well, listen, Kris, I just turned 40. I don't know what generation you think I'm in. I'm just kidding. I'm just kidding. No.
Okay, that was my generation.
No, but I get what you're saying. No,
it's just different, right? And so it's to parent kids from a place of curiosity when I was brought up with, don't do as I say, not do as I do.
Yeah.
And it's because I'm your parent.
Yeah.
When actually, and I think social workers probably do this the best because most of my friends are social workers. Yeah. And we all sort of talk to our kids like they're mini adults. Like, okay, so here are the things that you need to know, right?
Yeah.
We talk about relationships. We talk about sex. We talk about drugs. We talk about alcohol. We talk about vapes. And it's not in a place of lecture because kids are not responsive to lectures. They are so good at tuning us out. But it's a place of, well, what happens when you go to this party, and what kind of substances are there, and is it White Claws or is it beer or is it vodka, or, and do you understand the difference between those? And so we have like these very grown-up conversations with the kids, and my husband's like, oh Lord, like they're never going to do anything because they're going to be like, this is all gross. And
yes.
I said, well,
this is all gross. Well,
good when you talk about sex with the kids that, oh, my mom, I'm not ready for that. And I was like, well, you should be.
Yeah.
Because, and it's not a scary thing.
Yes.
None of this is scary if you talk about it from a lens of, I just need you to have more information than I had.
Yeah, 100%.
Right? Like when I was breaking filters off of Camels in the summer camp because I wanted to break like all the other cool kids who were smoking, but I was not cool. I was super nerd. So I was like, well, I can smoke this without a filter.
I'm sorry.
I mean.
And then people are like, what's a filter? Like young people. I mean, like.
What's a cigarette?
What's a cigarette?
Ew. So, you just finding those motivations. To your point, I wanted to be cool. You liked a guy. Yeah. Like what's the gateway emotion? And it's not wanting.
Pick one.
Yeah. Right.
Pick 5 at the same time.
Yeah.
And that's the thing. But I think what you're saying is the thing. It's like what I heard underneath what you said was like, we're telling them information, but people are so basic. We operate on feelings that we don't really understand. Mm-hmm. So if we want to feel differently, if we want to change our brains, we know how. And I think that's the thing that parents say makes them fearful, is if I'm sharing this information with my child, am I just giving them a license to be able to go out and do whatever they want with that? And I'm like, no, you're just living in reality, man. Like, you know, and I think that's the thing that we have to realize. We can only do our best. We really can only do our best. And a lot of things I also see, and I hate that we get into these like bubbles of like helicopter parents versus, you know, like all of these like classic cases. Ultimately, it's fear. We're all afraid. Mm-hmm. When we walk out of our doors every day, we're afraid. I mean, God, we went through COVID, you know, like that's what the world we're living in right now. That's all of this. And guess what? Your kids are afraid too. And so I think there's a cluster of people, I want to say it's more led by women because I really believe that it is, but it's definitely social workers who I think are encouraging their kids to really try to rise above. And for example, be the kid at the senior party with the Narcan. Mm-hmm. Be the kid who's willing to be the DD, will be the DD, because you think that that's important. And that includes all substances, not just alcohol or whatever. I think this generation, Gen Alpha, Gen Z.
I can't keep up.
I mean, I think they have a totally different way that they think about life. All you can do is let them know you care, remain vigilant and curious. And like literally, if you have values that you want them to have, you need to actually be acting out those values and like showing them what that looks like. And that's so hard to do. I'll give you an example. And a lot of women in my life were like, what? I took my son, who's 6, Luke. When he was 5, he started coming to the Live for Lally truck, which is a full-blown syringe service program. What? Like, why would you, what do you mean? Like, what did he do there? I'm like, he handed out the fruit. Because we have like a little boat, like it's a little like tent bodega off the side of it that just is like snacks. And it's like, I wanted Luke to see that you can engage in the world and something that was age appropriate for him. Like, would you like to hand out the fruit and do art stuff with the kids? Yes, that sounds awesome. And he loved it. He's like, I made the bag with the bananas and the thing. And then I shouted to Luis, hey, we need some toiletries. Like, like literally, that's all he did. It's not like he was handing out like clean pipes, okay? Mm-hmm. He wasn't. He was just sitting there because I want him to know that it's okay to be kind in this world. That's the value. That's the core value I wanted him to experience, and it's really hard to find experiences to do that with your kids. How do you do that with your kids besides, oh, look at the homeless guy on the street. You don't want to end up like that guy. Is that the value even? That's why I say this is coming from fear. You don't want your kids to end up in a bad way.
Right.
So I think we just have to kind of be creative. But like you said earlier, we go back to our base mode. And in my family, you were saying it's kind of like do as I say, not as I do. Same in my family. A little different, though, because they just looked away. Mm-hmm. I think a lot of the time my parents were like, all right, they're going to do it. It's not a big deal. Like, you know.
Yeah. Well, and I guess that's why I feel like the conversations, opening the lines of communication. And I always say to my kids, I don't care what happens. I should be your first call. Don't worry. I'm not going to lecture you in that first call. I'm not going to shame you in that first call. We're going to get through whatever it is that's going on to get you safe. And then we're going to unpack it when we're ready. Like, but make me your first call. Like,
how has that worked out?
Well, my daughter's the DD all the time. So she's very, in control of herself.
She's a social worker's daughter. Is she the oldest?
Yes.
Yeah, there you go.
So they actually had a party a few weeks ago, and she was like, oh my gosh. She called me and said, I'm going to be a little bit later than I had anticipated. And I was like, I hope you're okay. She's like, I'm fine. So the next day she's like, oh, this one was really sick, and she was throwing up everywhere because she was doing shots, and she never does shots, and she's like really, really tiny. And she goes, and I fed her some Taco Bell, and I put her to bed, and I told her, listen, you're going to school. You need to find your people because you can't be doing this in school without your people. She's like, you need someone to keep you safe if this is how you're going to act.
Good for her.
And I was like, okay, my work here is done.
Yeah, no, absolutely. But I love how you said specifically, I want to be your first call. And what I'm curious about too, and like what I think a lot could be really beneficial to a lot of people who might be listening to this is like, what do you do then on the first call? I think that's where people get stuck.
You just pick
the
them
details.
up and you love on them.
Yeah.
Thank goodness nothing happened to
glad
you.
you're okay.
Thank you. The car is safe where it's at, or we'll get the keys and we'll move it ourselves.
Yeah.
Like, I'm just glad you're okay. We don't have to educate.
But Mom, I'm calling you from the inside of a jail cell.
And you know what?
I love you so much.
Yeah.
Yeah.
And we'll deal with it, right?
that's a great point,
The
yeah.
beautiful thing, and I guess because I've worked in crisis scenarios for so many years, the beautiful thing is we have to tell ourselves, this is not a forever circumstance. How we deal with it will either create a lasting circumstance or a point in time reflection. So how you respond is the most important thing.
Yeah.
I don't want my kid to carry 20 years of shame because I picked them up and acted some kind of way through my own emotions.
Absolutely.
You know, and so I think that if we understand the impact of who we are and how we look at our kids and how we respond to our kids and how we respond to our clients and how we respond to our community, why? Why
Yeah.
make life harder for anybody when all we have to do is be kind?
Oh my gosh, 100%. I think so many people too, like right now, they're looking at what's going on in our country and in the world, and they're saying, what can I do? What can I do? You literally can do exactly what you just said. You can work on putting a mirror up to yourself and saying, like, do I like the way that I'm responding to this? Is this helping me? Is this helping my kids? You know, being honest with ourselves. That's sometimes the hardest thing to do, right? And I think that's one of the biggest challenges parents have, so that once we're honest with ourselves, we can learn how to breathe and we can learn how to just be the parent that they need in that moment. And you're not going to get it right every time. That's the thing. Don't think that there's like a perfection thing here, but to be able to at least like stop and pause. We are not good at that.
No.
But just learning how to do that in your own family, that's literally all you need to be doing, because your kids are gonna watch you. They're gonna see you, and then they're gonna go out and do that same thing.
Yep.
And you might have the kid that's kind of like on the fence, but you know, the risk taker, or
Well,
a couple of them, whatever.
Yeah, I mean, for sure. Kid, you know, I talk about my eldest because she's the most experience I have as a parent.
And how old is she?
She's 18.
Okay.
So I just dropped her off at college, you know, and she's out. I mean, she is living her best life. Week 1, this girl is like, first day, I'm out with my friends till 2:30 in the morning. She has like one friend, then she found 10 other friends.
Oh yeah.
And so like she's out. And
Good for her.
I'm everything in my being not to stalk. Well, I am stalking her.
You
on
mean like Life 360?
360, yeah. Like I just want to make sure she gets back to her dorm, right? But I'm like,
Yeah.
just leave her be. Let her figure it out. She has to be able to make mistakes. And that's the other thing I think we have learned is not to let our kids make mistakes.
Yeah.
Because mistakes are scary, you know?
But mistakes are the things that they're like, if you go back to like your core memory bank, you're going to find that the mistakes are actually the thing that might have led you to do something differently for yourself or somebody else.
100%.
Might have helped you pick a career, might have helped you pick a person to like be with. Like,
I always tell people, natural consequences speak so much louder than logical consequences.
yeah. And here's the thing though, and I think just going back to like drug use for a moment, today, making one mistake though is really scary. So I just
Yes.
want to say this, like, because I don't want to like send a message that's like brushing off what's going on out there, because I by no means ever want to send that message. But what is being used right now on the street is very, very, very potent. It is unsafe. We have a very unsafe, unregulated drug supply that we don't own. America does not own our drug supply. The Mexicans do, the Chinese do, and the Arabs do, okay? That's how this works, okay? And then it comes here. And so at any given day, we don't know what's in Schaumburg, Illinois' drug supply. The only way to know, and we have one, is if you have like a spectrometer on your truck, which is like a machine that tests down to like the percentage point, the sample of drugs.
Cool.
I know, it's very cool. And if you're a legislator out there and you're listening to this or like care about this at all, like we don't need to wait for the police evidence locker or the toxicology report anymore. You just come to the Live for Lolly truck and get your stuff tested, okay? Or your kid's stuff tested, okay? You can do that as a parent. You can be an advocate for your kid. But it is not safe what's out there right now, and it's not your kid's fault that it's not safe. But that could be death. It really can. And I don't mean to say that to like scare people. I'm just talking about literally the reality of what's going on right now. So as parents and as professionals, I think we can arm ourselves with information like, come on, there's been so many stories, so much news talked about the overdose crisis and what's going on with fentanyl. But I think we're so afraid of that actually happening that we don't, like, for example, we wouldn't know how to create like a safety plan around like what do I do when that happens, to the point where we won't have Narcan in our house because we don't think our kids are going to do this and we don't think their friends are going to do this, or I don't think my roommate who's depressed is going to do this, because we just don't want to believe that it can happen. But look around you. How many people do you know personally that have gone through addiction or used drugs now, or, I mean, let's not do that to ourselves anymore. Mm-hmm. It doesn't mean that you're going to have a problem. It's just you're going to be ready when it happens. Mm-hmm. So I think as parents of young people under 18s, it is okay, absolutely okay to not only have Narcan in your house, but to talk to your kids about why it's important to know about it. And we actually passed a law to make sure that that just a couple years ago, that schools, when they are ready to have that information available for high school students, of course, age appropriateness, that we can talk to them about overdose prevention. Like, come on, like, that's where we are.
And that's where it starts, right? I mean, you got to start young.
And every school has to have naloxone there. Every school. Every library now. I mean, yeah.
That's fantastic.
It is, but still, like
scary.
It's totally scary. And again, like, I don't mean to like sound like, this is your brain on drugs. I just tend to like to encourage people to live in reality.
Yeah.
That this isn't so far-fetched. I mean, it's the number one way to accidentally die in this country. So, ugh. Yeah, I know, okay. So depressing.
Let's finish on a high note.
I know, but
that last soundbite's very like.
But that's why we created Live for Lolly. Yes. Okay, we created Live for Lolly and other organizations in the community for this very purpose, to inspire hope, to create change if we can, but really just to like keep people alive. Like, literally, that's at the basic level. We have a responsibility to keep people alive. And I think we've done a pretty good job convincing the state and our leaders that that's true, except for Trump. I'm so sorry I had to go there, but we're getting our funding stripped left and right. You guys got to know that out there.
Yeah, and again,
this is not a perspective of the bridge. This is my perspective. Okay.
Well, and I just want to say, I'm so sad for you that you had to go through such a horrible, horrible thing to give birth to such a beautiful mission to help the community and to continue to further its mission, even though you are arm's length from that. And it's going to make me cry because when you endure such pain.
Yeah.
So thank you for being you.
Oh, that's so sweet. I don't know what else I do, because grief is the way that this is the way we grieved. This is the way I grieved and survived, frankly, survived. Who knows where I would be and what I would be doing. Maybe I wouldn't be married. I wouldn't have my kids. Right. I wouldn't have, I wouldn't be talking to you. And I don't mean to say like, I wish that this definitely would have happened to Alex. I do not.
Right.
He did not deserve this, but.
I can't believe I'm so teary right now.
I can't believe you don't have a Kleenex box here. Look at what the stuff you're talking about at this podcast.
Well, but you're amazing. And thank you so much for coming on. Oh my gosh.
Can I just say, like, to anybody listening, if you need to talk to somebody, if you want to get in touch with like anybody because the way that Live for Lolly does things is we're peers first. So we don't come in as like clinicians. If you want that, we bring that in, but we come in as peers. So there's no pressure. So like if you need anything, if you just need someone to talk to, if you need a mutual aid group, if you just need to sit somewhere, Literally, if you, and then beyond that, if you know and you feel like, okay, there's a problem with somebody in my life and I need actual supplies, you can order them on our website. There's literally a number you text and you just order them and somebody will drop them off or mail them to you. Or you can come out to any one of our 12 truck locations across the suburbs. And just on the days that we're there, you can find all about that on their website. We distribute everything from socks and underwear to toiletries, to fruit, to rock kits for people who use crack rock as their drug, or any form of ingestion of drugs. We distribute those sterile supplies, Narcan, wound care, safe sex kits. I mean, everything that you could really think of, we have it, and we will give it to you. So please find us somewhere. It's a giant purple truck. You can't miss it.
Giant purple truck. All right. Well, thank you so much for coming on.
Thank you for having me. It was a pleasure
to talk to you and catch up with you.
You too. And thanks for all you do. You guys are a beacon of hope in our community.
Oh, thanks. Mutual Admiration Society right here. Thank you again for joining us today for today's podcast. And again, I'm Kris Salyards with the Bridge Youth and Family Services. Thank you.